Good evening everyone. Today we'll discuss the OSADA's triple flap technique for adenomyoma surgery. So basically there is a total 6 steps in this procedure. Okay. First step. So basically the OSADA's triple flap technique for adenomyoma. What are the procedure? The first A point is telling. First you will give an incisions over the uterus. Okay. How will give the incisions? Okay. Suppose this is your I will tell the step incisions over the uterus. Incision will given sagittally over the uterus sagittally. Okay, so step 1, this is the uterus. You will give incisions, sagittal incisions. Okay, sagittal incisions. This is the incision sagittally. Okay, the second step, that is step B, is telling that is step B. That is step B is you have to debulk the uterus. Debulking. Like how will debulk the uterus? Debulking means the total adenomyoma has to be removed. Okay, suppose this is your uterus. This is the uterus. This is your endometrial cavity, and this part is your adenomyoma. This part is your adenomyoma. So in the second step, you have to debulk the uterus. That means debulking means you have to debulk the adenomyoma part. Okay, so debulking of the adenomyoma part from the uterus. How will debulk? Debulk means how will debulk? The debulk means you have to remove the adenomyoma. The myometrium has to be removed. The adenomyomatic tissue has to be removed. That is from there should be a 1 centimeter margin from the serosa. Suppose this is the serosa, this is your serosa, so you will make a 1 centimeter margin. This is your 1 centimeter margin left behind. 1 centimeter margin has to be left behind below the serosa. 1 centimeter margin has to be left behind during adenomyomectomy. And this is another 1 centimeter from this is your endometrial cavity. So another 1 centimeters from the above the another 1 centimeter above the endometrial cavity. So basically you have to remove the adenomyoma. This is the adenomyoma you have to remove. There has to be 1 centimeter above the endometrial cavity. 1 centimeter above the this is the endometrial cavity. 1 centimeter above the endometrial cavity, and there should be 1 centimeter margin be left behind below the serosa. This is your serosa. Suppose this is your serosa, then it should be 1 centimeter margin below the serosa. Okay. So this second step has to be there. In the first step, you have to incise the uterus. In the first step, you have to incise the uterus sagittally. After incision is given, the uterus will bisect. You will do bisection. That is the bisections of uterus is the first step. That is the bisection of uterus sagittally. Then after it will be completely 2 parts. You can see how it will be 2 parts. It is the bisection. Then you have to reach till the endometrial cavity. You have to reach the endometrial cavity. You have to do bisection till reach the endometrial cavity. Okay, so that if you till reach the endometrial cavity, you can know an extension of the adenomyoma. Okay, extension of the adenomyoma, you can easily know the extensions. If you open the endometrial cavity, then you can know you have to left behind 1 centimeter margin above the endometrial cavity. So you have to open the endometrial cavity. The bisection has to be reached till the endometrial cavity, so that you can know how much depth has to be excised for the adenomyoma tissue. So this is your adenomyoma tissue. This side also, this is your adenomyoma tissue. So this is your adenomyoma tissue. So you have to left behind 1 centimeter. This side 1 centimeter, this side 1 centimeter margin, and from the serosa 1 centimeter has to be left behind. This is the step 2. Step 2, they are removing the tissue. They are excising the adenomyoma. you have to enter your person's surgeon has enter your finger, or you can insert a artery forceps or any Foley's catheters tip you can insert it, okay, so that you can negotiate the endometrial cavity without excising the endometrial cavity, without doing any harm to the endometrial cavity. You have to excise only the part of adenomyoma from the uterus, and leaving behind 1 centimeter margin left behind below the serosa, 1 centimeter margin left above the endometrial cavity. This is a very important step, so that you can't affect the infertility in futures. So this is the main step in adenomyomectomy, that is debulking the uterus, remove the maximum amount of the disease adenomyoma, left behind 1 centimeter margin below the serosa, myometrial tissue will be left behind, and 1 centimeter above the endometrial cavity by keeping your finger inside the endometrial cavity, or you can put your artery forceps, or you can put your Foley's catheters. Now the triple flap technique will come, that is now you can see there will be two flap. Okay, this is the one flap, this is the one flap. The third step is, that is the point, this is the third step is your suturing of, because you are opening the endometrium during bisection, suturing of endometrium has to be done by Bickel 30 observable sutures. Okay, then you do suturing. They have done the suturing of the endometrial cavity. After that, you can see there will be two flaps. Okay, now the triple flap technique will come, that is two flap is there. Okay, this is the one flap, this is one flap. The third step is that you have to, the serosa has to be sutured, serosa of the uterus, one side of serosa, one side of uterine wall. Suppose this is the left side. If you see from over, this is the left, this is the right side flap, okay, this is the left side flap. Okay, left side flap. So how will do, because this is the left side, this is the left, this is the right. Okay, you can see this is the serosal surface. You have to oppose transversely serosal surface of uterus, suture in transverse plane of uterus, that is serosal surface along with the myometrium. So you have to oppose like this. Okay, so remember that left side, this left side wall, the left side uterine wall, the flap has to be created two flap. This is the total one flap has to be created by two flap. This is the anterior, this is your anterior flap, this is your anterior, this is your anterior flap, this is your posterior flap. Okay, you have to doing by anterior and posterior make us to be the transverse suture. That is the second flap has made suture of this two flap. One flap, this is one other flap, there is two flap. Then after that, the third flap, that is the step F, is the, now you can see these serosal sutures. Okay, serosal suture in the transverse plane. Okay, I will show you. You have to make three flaps. Okay, but you have a two flaps, so how will do the three flaps? The first, the suturing of two flaps, that is two flaps means, if you see in the right, left, this is the right side, this is the left side. If you see from above, this is the right side, this is the right, and this is the right, this is the left side. Okay, from left side you have to make this, from one flap you have to make two flap, that is, this is your anterior flap, anterior, this is your posterior flap, this is number one flap, this is your number two flap, this is your third right side flap. In the left side, the serosa, this is the serosa with your myometrial tissue. After removing the adenomyoma, you have to oppose this anterior flap, that is the number one flap with number two flap. Okay, so serosal suture of anterior plus posterior flap, that is the first and 1 plus 2 flap. Okay, so I will show, this is your anterior, this is first one flap, this is your posterior on the left side, this is the right side, posterior the second flap. You have to oppose these two. Okay, now this is the after suturing anterior and posterior. This is your one number flap, flap 1, posterior is your flap 2 is opposed. Now the third is suturing two flaps is done. The last step is your, from the right side, this right side flap, okay, this right side flap, will, this whole right side flap now covering over this part, okay, covering over this F step, the right side flap, right side uterine wall flap now covering over the second flap, 1+2 flap, covered over the first plus second flap, okay. So this is the triple flap technique. Now this will cover over this second two flaps suturing. Now this, how will see, this is a inverted, it look like a inverted T incisions, okay. So basically for adenomyosis, these are the very important steps. It's OSADA triple flap technique for adenomyomectomy. First step, you have to incise the sagittally sections, you have to bisect the uterus, you have to, bisection has to be reached till your endometrial cavity so that you can get a demarcation of the lesions, the adenomyoma size of the lesion, so that in the second step you can debulk the adenomyoma, maximum amount of tissue has to be removed with 1 centimeter, with you have to left behind this 1 centimeter margin, 1 centimeter margin, 1 centimeter margin left behind below the serosa, 1 centimeter above the 1 centimeter margin above the endometrial cavity. Then the third step is suture the endometrial cavity with the biaxial 30. Suture the endometrial cavity with biaxial 30. You have to do suturing. Next you have to make a two flap. For anterior flap, anterior is the first flap, this posterior is the second flap. You have to make the anterior and posterior, first and second flap, suturing of the two flap. Then serosal suturing of the in the myometer in the transverse plane of the uterus. Then this is anterior posterior flaps, 1+2 flap. Then the in the left side, in the right side uterine wall is cover over the left side 1+2 flap. This is the OSADA triple flap technique. This is to prevent. What is the advantage? It will cause obliterations, complete obliteration of the cavity, cause decrease bleeding, cause hemostasis. Very important OSADA technique. Prevent future rupture of uterus. This technique has, these are the advantages. It will complete obliterate the cavity, it is decrease bleeding, it is completely hemostasis, prevent the rupture of the uterus in the futures. Okay, this is the adenomyosis ultrasound features, this is the MRI features, okay. See, this is the triple flap technique, OSADA technique for adenomyosis. If you like this content, please subscribe. Thank you.